Ultrasound is a powerful diagnostic tool. The need for it can present itself in an acute situation where time is of the essence. However, lack of knowledge and experience of local care providers means they might not obtain appropriate images while using the ultrasound. This can lead to insufficient diagnostic quality, or the care providers may not be able to interpret the results at all. Quality of care can be greatly improved with the help from a remote expert who provides the local care providers with the guidance and assistance required in advanced interpretation of ultrasound images. A good example of a clinical case eligible for remote support are newborns with critical congenital heart disease in local hospitals which are in need of intervention during the first month. These cases need to be examined, diagnosed, and transferred to a congenital cardiac surgery center in a timely manner. In worst cases, the consequences of undiagnosed heart conditions can be dramatic for the baby, the parents, and society. Remote support could be used to prevent these most serious cases. Even in the less serious cases, remote support can spare the patient and parent of the trip to a specialist. Based on a questionnaire sent out to all pediatric cardiologists in Norway, approximately 240 remote consultations are estimated to be performed each month. Based on this, it is safe to say that there would be a substantial demand for an enhanced remote assistance service. Collaboration Live is a platform that allows a remote expert to see all the data from an ultrasound machine. A camera is connected directly to the ultrasound machine to provide audio and video. The remote expert can point at elements in the scene and combine additional visuals to it, providing explanations and instructions. The remote expert can also control the ultrasound settings if needed. In a study, 12 neonates were diagnosed with remote guidance. A remote pediatric cardiologist assisted a local doctor to determine whether the patient needed transfer from the local hospital to a cardiac surgical center for treatment. In all cases, the remote decision matched that of a local expert. How can we improve the communication between the local care provider and the remote expert even further? We could enable them to work in the same virtual space, and the ultrasound data would be presented to the local care provider in augmented reality. Instead of 2D video, a live 3D model is sent to the remote expert. The expert can inspect the patient as if he is there in person. He can directly see the actions of the local care provider and give instructions. We could also perform remote-controlled robotic ultrasound, which enables expert ultrasound examinations also in environments with radiation or risk of infection. The robot operates with 6 degrees of freedom and has a reach that enables access to all examination sites of the heart. It is operated in real time, and the movements are synchronized with the remote controller's hand to enable telepresence. Force feedback to the joystick controller gives remote expert awareness of patient probe contact. 2 cameras show the exact probe position relative to the patient. A local helper operates the ultrasound machine. The ultrasound image is streamed to the remote expert in real time over the 5G network.